to show you how this new product can improve the look and feel of a regular breast augmentation.
So we're putting in the implant into the pocket that we've just created. Ideal Implant is the newest technology in breast implant surgery in the last 25 years. Only about 100 pairs of implants have been put in patients across the country.
If there's a procedure, surgery, or technology that can upgrade your health, we're on top of it, and right now there's a plastic surgery in the testing phase that can change the style of breast implants forever.
Before having children, I had a decent-sized chest, and then you stop breastfeeding, and they become smaller, and then after the second child, even smaller, and after the third child, if possible, even smaller. So here's an example of a couple tops that I can't wear anymore. I don't fit in this, I don't fit in this. I look forward to fitting in them again.
Ideal Implant is the newest technology in breast implant surgery in the last 25 years. Only about 100 pairs of implants have been put in patients across the country. All right, so I'm getting ready to make the incision, and we're going to start with the right breast. The reason that Ideal Implant is great because it has the look and feel of a silicone gel implant, but there's no silicone in the implant. There's a baffling system. The baffling system allows you to have saline in multiple compartments. It reduces the rippling that some women get with saline implants. So right now I'm just dissecting through the breast tissue to get down to and identify the pectoralis muscle. Here's the implant. First thing we're going to do is put the filling tubes into the fill ports. So we're putting in the implant into the pocket that we've just created. I'm now filling the back lumen with saline. You can see already the huge change, and she's got beautiful projection and really a wonderful look to her breast.
We have Julie and Dr. Kevin Brenner from the Roxbury Clinic and Surgery Center, both with us today. Welcome.
Thank you.
Hi, Julie. Dr. B, how are you?
Dr. O, good to see you.
Good to see you.
It should be noted that you both
Yes, I have
are
met
at the
this gentleman
Roxbury
before.
Center. So
We rock at the Roxbury Clinic and Surgery Center. But we're talking about breast. Kevin and I we're part of a study. We're one of the few in the United States that are involved in clinical trials.
Yeah, it's an FDA trial to
on a new implant. And Julie
this.
got the new implant. But to put things in perspective, you know, since we started doing breast enlargement before you were born, we've always had two options. We've had silicone implants, which is silicone outside with gel on the inside, and what we call saline implants, silicone covering with saline, just salt water, on the inside. Those have always been our two options, but there have been problems with both of them. With silicone, some people didn't like the fact that it had silicone inside, and when it cracks, when it breaks, you can get that inside the body.
Absolutely.
The problem with saline implants, the design, there were some faults in terms of wrinkling, bouncing, and being able to see and feel the implant. I want you to explain to us how the new implant works.
Sure. So the Ideal Implant is the newest technology. We are involved in an FDA investigation to compare the longevity and the leak rates in this new implant to the standard saline and the standard silicone. What's unique about this implant is that it's got, first of all, two lumens, or two areas that you fill with saline. And so there's a posterior lumen on the back and then an anterior lumen on the front. What makes it different than a regular saline implant is that in addition to the two lumens, there's an internal baffling system. And this implant was specifically designed to look and feel more like a gel implant. That's why we like gel implants, is because of the look and the feel when it's inserted into a patient. So this is designed to be, for lack of a better word, a hybrid implant in between the two.
And the pluses are the things that we didn't like in the past about saline implants. Number one was the wrinkling effect, right?
Right.
Something else that we call bounce. Can you explain bounce to us?
With a saline implant, what a lot of my patients have complained about is that they do bounce around a lot, and I think what the sensation is that they feel the saline sloshing around within the lumen of the implant.
More like a water balloon.
The Ideal Implant that avoids all that problem.
Reduce bounce.
Reduce bounce. So if this is the ideal implant, who is the ideal candidate? or the ideal implant?
The ideal implant can be put into any woman who wants the look and the feel of a silicone gel implant, which is why Julie came to me in the first place. But it may be apprehensive because of the risk of having either having the silicone in their body or the risk of silent leak or silent rupture of an implant, which would kind of mandate that they have an MRI to evaluate it. This avoids that.
And Dr. Brenner and I, whether it's saline or silicone, we're basically doing the same operation. We can go through the armpit, we can go around the nipple, we can go in the crease, we can go above the muscle, below the muscle, and we have an animation to show you how we typically do breast augmentation. In this case, we're making incision in the crease of the breast. We create a pocket below the pectoralis major muscle. We slip that implant in and back of the muscle, and voila, you have your breast augmentation.
So, Julie, how long has it been now?
It's been 2 weeks.
2 weeks. So I want everyone to look at a picture of you before.
Okay.
And after, and that's
There you go.
in 2 weeks, and it looks.
That's an amazing result for 2 weeks.
And more importantly, what do you think?
I love them. I love them, and I feel great.
Is that why when I asked you the ideal candidate,
No,
you said yes?
And that was me.
You know, and somebody like Julie, ideal, she had had 3 kids. She's fit. She was a bigger cup size before, got smaller after pregnancy.
And now she's actually, she didn't want anything crazy. Julie is a confident, secure woman.
Yes,
she just wanted to look the way she did before she had her kids, and that's where she is right now. And so I'm proud of her, and
Very
I think
nice.
she looks great.
I'm proud of you. Good work.
Dr. Brenner, thanks for being here. Julie, thank you.
Thank you.
And we're excited about this new implant. We really are.